And I should point out that from the homepage of the website, there is a button that people can press and watch the documentary in its entirety if they so desire. Now, Mary, in terms of this as, I guess, educational tool, what are some of the uses that SSO has?
Well, we've already seen some of the benefits of having such an educational tool as we've been traveling across the province with Fearless and getting people's reactions to it. We've heard from a lot of young people that they never knew about schizophrenia and they never knew what it meant. And also we've heard from people that it's a very interesting documentary that allows them to better relate to people with the illness. So we were using it across the province as an educational tool, and I think, as Jesse has mentioned, it was very brave on his part to be able to expose himself very publicly that way with his illness. And going back to talking about stigma, one of the things that Fearless does is break down the stigma associated with the illness, because it also focuses on Jesse's family, and it also focuses on another young person whose brother had schizophrenia. So it's been a great educational tool for us. It is often, what we've noticed as well, it's the first exposure that people have had to the illness. So when people see it, they've never had that kind of opportunity to really look at a film, a documentary like this, and begin to understand. And they're very appreciative for it as well. The other thing that we're finding is it's giving encouragement to other people and families living with schizophrenia to begin to tell their stories. And we firmly believe the more stories that we're able to tell of how people have experienced this illness and how families live with this illness, the better we are able to connect to others and the better able to reach out to people to encourage them to either get involved with our organization to help us further our cause or to get the help and support that they need.
That's wonderful, Mary. And it's going to lead me to my final question, and a very important question, and that is if people listening want to donate to the Schizophrenia Society of Ontario, how do they go about doing that?
Well, Stephen, that's a very interesting question about donating. And oftentimes, in today's society, everybody wants money to do something else, especially in the area that we work in. People can donate to us by either going online through our website or by calling any of our offices across Ontario, which are also listed on our website, as well as our main office in Toronto, or by mailing in a gift to us as well. So that's a great way to make a donation. And I think as people think about making a donation to us, people often ask, why should I give to the Schizophrenia Society of Ontario? People should give to the Schizophrenia Society of Ontario because we are the only organization in Ontario that helps and supports people with this illness and their families and is working to change the way people think about mental illness and schizophrenia. We're reducing discrimination. We're trying to eliminate stigma. We are funding research that is going to help us better understand this illness. And also, I think it's very important for people to know the Schizophrenia Society of Ontario exists because of people's donations. We do get some support from government, but very little support. So in order to do the work that we need to do, in order to change the way people think and reach out, we need people's help and support through their donation, through becoming involved with the organization, and to really becoming ambassadors for us and spreading the word and changing the way people think.
Thank you very much, Mary. I'd like to thank both Mary and Jesse for being on the show today. We're going to take a short pause, and when we return, we'll be talking about access to treatment.
Did you know that 1 in 100 people will develop schizophrenia in their lifetime? 1 in 100. Schizophrenia is a treatable brain disease. The problem is, people can't get treatment. Be a part of the solution. Please give to the Schizophrenia Society of Ontario. For more information, visit www.ssoaware.com.
We're back with SSO Aware. In this second segment, we'll be talking about the issue of access to treatment in Ontario. I'd like to welcome to the studio Vani Jain, Manager of Policy and Community Relations for the Schizophrenia Society of Ontario, Dr. Zanur Ismail, a prominent psychiatrist at the Centre for Addiction and Mental Health here in Toronto, Peter Andruski, a family member and volunteer for SSO, as well as Michael Alzamora, also a long-time volunteer for the Schizophrenia Society of Ontario. So, Vani, let me ask you, in terms of serious mental illness, what are the sort of challenges that people face in accessing services?
I think what's really needed is a more comprehensive system of care. There's several things that someone with a serious mental illness would need in order to recover. Psychiatric treatment is one of those. Community-based services is another, and social supports as well. And we've seen that people experience barriers accessing all three of these things. So in terms of psychiatric treatment, we see many people who show up to the ER in need of emergency psychiatric care and are told that, either they have to wait a long time to see a physician there, or they're told that there aren't enough beds for them to be admitted. In terms of community services, there's really not enough capacity in the community sector to serve all the people who need treatment. So, there's some of the best programs out there have quite long waiting lists. And in terms of social supports, we see people having trouble accessing things like ODSP, adequate employment, supportive housing. So it's really a challenge for people with serious mental illness, I think, for the care they need.
And Dr. Ismail, what would you say is the difference between accessing treatment for physical versus mental health problems?
I think there are two fundamental issues here that really differentiate between access to treatment for those with physical and mental illness. One is the triage process, and the second are consent and capacity issues. Regarding triage issues, when people show up at an emergency room, if they have chest pain, for example, they're at the very top of the list, and if they have a broken finger or a separated shoulder, they're further down the list. And people with severe mental illness are somewhere in between. Unfortunately, they're closer to the end of a broken finger or a separated shoulder than they are to the top of the list. And it depends on the culture in the emergency room and the triage nurses and the emergency docs, their experience and their services. So people can end up waiting a very long time, and often they can have concurrent physical illness along with their mental illness, and this is sometimes overlooked because they are labeled as someone with a mental illness, and sometimes their physical illness gets lost within that. The second is that, unlike using the examples of a cardiac disease or musculoskeletal injury, consent and capacity to make treatment decisions aren't really affected in those illnesses, and it's more or less straightforward. Someone comes in, they agree to treatment, they're often clear thinking. Fundamental with severe mental illness, it can be that their ability to recognize illness, understand the risks and benefits of treatment, the risks of not having treatment and alternative options is potentially skewed. And this adds a whole layer of complexity to treatment of these issues, especially for those who aren't necessarily familiar with these issues, i.e. frontline emergency staff. And even those who have a lot of experience in this area still find it difficult to navigate these often murky waters of consent and capacity. So that's, again, another added layer of complexity to the whole access issue, and it feels that sometimes it's easier to sort of throw your hands up in the air than navigate through that and really advocate for someone to get treatment.
And in terms of speaking of navigation, Peter, as a family member, what's been your experience with, I guess, quote unquote, the system, and what would you like to share?